Okay, well, I see I'm spotlighted, so that must be my cue. Hi, everyone, and I'm Richard Kravitz. I'm the director at UCCS, and it's a pleasure to welcome you to this, our fourth and final subsection of the UCCS Academic Showcase for summer 2020. It's really a pleasure to welcome you all here and to express my congratulations to all of the students for completing their projects and doing all the hard work that was needed to get to this point. Also, thanks are due to the internship hosts who sponsored our students. We really appreciate it. And finally, our staff has been working hard to make this session successful, even under really different circumstances than obviously than what we normally encounter. So we've had 3 great sessions already. We look forward to a 4th, and I think we're ready to begin.
Great, thank you so much, Dr. Kravitz. So thank you everyone for being here today. So in regards to today's format, we will have the student present their poster, and then we will go ahead and field 1 question from the internship host site. If the internship host site does not have a question, then we will throw it over to the academic team. And then we'll have the next student present, and then they'll get their question. We'll have open Q&A at the end of the session, time permitting. The last 3 sessions we were able to have open Q&A, and so audience, if you do, as a student presents and you're like, oh, I do have actually a follow-up question, go ahead and jot down the student's name in your question, because you can go ahead and likely ask that at the end of the session. All right, and with that, we're gonna go ahead and get started, and our first student is Angie Yee.
Hi, I'm Angie, and my research presentation is Cap and Trade, benefiting all or just some. In 2004, greenhouse gas emissions in California reached over 490 million metric tons. California's response to this was a cap and trade program that was launched in 2013. This put a cap on greenhouse gas emissions and gave polluting facilities allowances that they were able to sell or buy more of. And this means that facilities didn't have to reduce their emissions. This could be a problem because research had shown that polluting facilities are more likely to be located in lower income communities. With this being said, my research question is, how has a cap and trade program affected the air quality in different income counties? My hypothesis is that the program won't be as effective in bettering the air quality in low income counties. To test this, I separated the 58 counties in California into low and high medium household income and by location to account for population densities. To measure the air quality, I looked at the percent change in greenhouse gas emissions for each county from 2013 to 2018. Greenhouse gas emissions in high-income counties decreased around 2%, while low-income counties actually increased by almost 5%. Figure 3 shows that the program was effective in both counties until 2016, but afterwards there was an increase in lower-income counties, which explains why they had an overall increase in emissions. According to Figure 4, we see that low-income counties in the Central Valley had the greatest increase in emissions. In conclusion, the data does support my hypothesis and shows that the cap and trade program has not been as effective in reducing emissions in low-income counties. My policy suggestions are to allow regional air districts to have more jurisdiction on emission limits and to support policies that provide incentives to creating sustainable technology. These results show the importance of creating and evaluating policies through a racial equity lens. Thank you.
Great, thank you so much, Angie. And so this summer, Angie interned with the Cal EPA Environmental Justice Unit. And so if anyone from the office would like to go ahead and ask a question, just please raise your hand, and Sandra Wilson in our office will go ahead and call on you and unmute you.
Hi, Dildy, if you can please introduce yourself, or state your name, and then ask your question.
Hello, everyone. I'm Dildy Reyes, and I'm with the California EPA. And I actually just wanted to give a big shout out to Angie and just thank you, Angie, publicly for all the wonderful work you did. And just note how quickly you picked up on everything we were trying to do. And I'm thrilled that your policy question here actually is applying a lens of racial equity to a very, very critical program for the state. So thank you for your work.
Great, thank you. So thank you, Angie. And our next student is Maya Bowdery.
Hi, I'm Maya, and I'm a student at UC Davis. PG&E, Southern California Edison, and San Diego Gas and Electric are the only available energy providers for over 20 million Californians and have the interests of their investors at heart. But what about local needs? What if a community isn't satisfied with the available renewable options or wants their mayor to have a say in where their energy is sourced and where the revenue goes? That's where Community Choice Aggregation, or CCAs, come in. CCAs let municipalities aggregate energy demand and purchase energy on behalf of their residents while continuing to use their affiliate utilities' transmission, distribution, and billing systems. Residents are automatically opted in and immediately enjoy lower rates and cleaner energy sourcing. Because CCAs are nonprofits, all revenue is reinvested into local clean energy projects that can create jobs. But who reaps the benefits that CCAs provide? This was the focus of my research project. I theorize that because cities with smaller and more educated populations are more politically active, they would be more likely to be able to build the grassroots support necessary to implement a CCA. I also theorize that wealthier cities would be more likely to afford the startup costs of CCAs. To test my theory, I gathered current US Census data on median household income, poverty, education, and population size for all California cities. I then ran t-tests to determine if there were significant differences in these variables between cities with and without CCAs. The results are shown in Figure 2. Cities with CCAs are significantly wealthier and more educated than cities without. Population differences were not significant. I also created an index with my variables with higher values indicating smaller populations that are wealthier and more educated. As you can see, cities with CCAs tend to have higher values. All this goes to say that wealthier and more educated cities benefit most from CCAs. Therefore, the state should support the implementation of these programs in poorer and less educated cities. Funding for education and outreach could increase community support, and funding and grants for the initial costs could increase affordability. As California forges a 100% clean energy future, we must be sure that the benefits of CCAs are equally experienced. Thank you.
Great, thank you so much, Maya. And so Maya interned with the California Energy Commission Communications Division. And so if someone from the office had a question, if you can go ahead and raise your hand and Sandra will call on you and unmute you.
Hi, Sandy. If you can please introduce yourself and ask your question.
Yes, my name is Sandy Louie. I'm the Media Relations Manager for the California Energy Commission. I really enjoyed Maya's time at the Energy Commission. And as part of your research, did you also look at the issue of, in terms of the data, did you look at anything in terms of not only income, but also the area where either how much clean energy that they have or are right at this point? So in terms of the CCAs, not only the income, but how much they already have support for clean energy.
So if I have your question right, there are different renewable blends that CCAs offer. The average is 52%, that's the default package. 52% of the energy offered through a CCA is renewable. I did not look at variances between programs and the renewable blends offered. I think that is an interesting question though. Here I was mainly focused on the distribution of these programs and what communities and types of people benefited most. That is a really interesting question though, and if I had more time, I'd love to dive more into that.
Great, thank you very much. Thanks, Maya.
Great, thank you so much, Maya. All right, so our next student is Audrey Zenner.
Hi everybody, I'm Audrey Zenner and my project is about drinking water equity and nitrate contamination in California drinking water. In 2012, California passed the Human Right to Water Act, which stated that every human has a right to clean, accessible, and affordable water. However, some Californians still have unsafe drinking water. California regulates drinking water quality using specific maximum contaminant levels for each contaminant, including nitrate. For my project, I looked at the 50 community water systems that violated these nitrate maximum contaminant levels within the last 8 years. My research question was, how does economic status relate to nitrate contamination in drinking water? I used data from the US Census Bureau and from the State Water Resources Control Board. I chose to focus on community water systems because they serve year-long residents, and I omitted water systems that I couldn't find corresponding census data for. I compared the number of months of a community water system was non-compliant to the median household income level and unemployment rates in their city. I found that 75% of non-compliant water systems are in cities with household income levels below the state's average, and that 54% of non-compliant water systems are in low-income communities. I also found that 65% of non-compliant systems are in cities with higher rates of unemployment than California's overall rate of unemployment. So in conclusion, California water systems that violate maximum contaminant levels for nitrate are more likely to be smaller systems found in cities with worse economic status, which shows the inequity of water access in California. The most ongoing offenders are often smaller water systems because they don't have the financial means to maintain high quality filtration systems. Going forward, the state should continue to support consolidating water systems into smaller water systems into larger ones to help decrease the cost of filtration and management, and provide ongoing long-term funding to small water systems. Thank you.
Great, thank you so much, Audrey. And so this summer, Audrey interned with the California Council on Science and Technology. So if anyone from CCST would like to go and ask a question, I already see a hand raised. Sandra will go ahead and call on you and unmute you.
Hi, Sarah, if you can please introduce yourself and ask your question. You're now unmuted.
Hello, I'm Sarah Brady. I'm the Deputy Director of the California Council on Science and Technology. Hi, Audrey, good job. It's been a pleasure working with you. You just dove right in and made really important contributions to our team, so thank you. My question is about one of your conclusions for long-term funding. And given the current economic landscape, that might be kind of difficult. Can you talk a little bit more about where that funding might come from, or if there are other solutions kind of in the shorter term?
Yeah, hi Sarah, that's a great question. So part of the argument for consolidating smaller systems into larger systems is that it will decrease long-term costs by sharing them over several water systems. However, that can still be expensive because you have to bring the smaller systems up in in the filtration systems. You have to modify them to be compatible with the larger systems. So some places that funding can come from are local and state level broad special taxes and general funds, and also taxes on fertilizers and pesticides that create the problem.
Great, thank you so much, Audrey. And so our next student is Andres Gutierrez.
Hi, my name is Andres Gutierrez. Energy production for households in Sacramento requires the use of power plants that can emit harmful substances into the atmosphere, polluting air quality. In 2018, the Sacramento Municipal Utility District, Sacramento's energy provider, signed their Integrated Resource Plan, which set the goal for the utility to produce 100% clean energy by 2040. But to mitigate climate change intensification, SMUD signed a climate emergency resolution on July 16, 2020, which shortened the goal to 2030 instead of 2040. The following research sets out to answer how will SMUD's commitment to 100% clean energy by 2030 affect Sacramento? There's sufficient evidence to prove that this commitment will advance Sacramento's economy, mitigate climate change, and reduce health risks. Using energy resource data from SMUD's 2017 and 2018 power content label, there is a clear decrease in renewable resources being used to produce energy, but their resolution helps to produce 100% renewable energy. Data from PSC's California Power Map and Google Maps shows the emission rates for each of the 5 plants that SMUD operates, as well as how close to the nearest sensitive receptor each plant is. Sensitive receptors are those more at risk to high health impacts, including elderly homes, schools, and hospitals. I found that 4 out of the 5 plants that SMUD operates are located at least 1 mile away from the nearest sensitive receptor, and this poses a very high risk to their health. Renewable energy would reduce this health risk by producing little to no air pollution. According to research done by the Solar Foundation, solar jobs increased 44% between 2014 and 2019, advancing the economy, and SMUD's resolution will also increase the market for solar energy resources. I propose the shutdown of harmful power plants, the funding of renewable resources, and stricter monitoring of emissions. Sacramento can only benefit from this resolution, and if other cities follow this example, can benefit too. Thank you.
Great, thank you, Andres. And so if I can go ahead, and so he interned at Environmental California this summer, and so if anyone from Environmental California has a question, if you want to go ahead and raise your hand, Sandra will go ahead and call on you. And if not, a question from the academic team?
Hey, Andres, this is Ross from your professor for Poll 195. I just was curious here. So you've got the energy sources for SMUD there on the figure 4. And I know renewable energy is pretty stagnant, but I was wondering why solar energy, why you think maybe what research you found that said that solar energy hasn't grown at all between 2017 and 2018, but why wind maybe has. It was a bit like major projects that had been happening, or what do you think?
Yeah, specifically for this chart, this is SMUD's power content label, so this is only SMUD. And I think in 2018, when they signed their resolution, they signed on for more wind resources. So the wind increased a little bit, but the offset was that they were producing more with natural gases in other areas. So that's why I mentioned that renewable energy decreased, because even though they provided more wind power, natural gas also increased, and natural gas is a fossil fuel, so it does burn, emissions, but not as much as typical coal or nuclear power plants, but it still emits a certain amount. And so the goal is that one day, they'll lower natural gas emissions as well to the point where it's just strictly renewable. And they started off with wind because solar just wasn't, they kind of figured it out afterwards. They did sign more rooftop solar panels to residents in Sacramento.
Okay, cool. Thank you so much.
Great, thank you so much, Andres. And so our next student is Emily May.
Hi, my name is Emily, and my research is on the impact of the ban on affirmative action, also known as Prop 209, on Asian Americans in the UC system. Prop 209 passed in November 1996, so almost 24 years ago, and it prohibited the use of race as a factor in college admissions. However, this year's Prop 16 calls for repeal of Prop 209 and the reinstatement of affirmative action. So with that, I wanted to take a closer look on how Asian Americans specifically were impacted by the ban. There are wide disparities between educational attainment for Asian American groups compared to the US average, as shown in the first graphic on the left. These disparities, like high school graduation rates, impact Asian Americans throughout the college admissions process. From the UC undergraduate admission summary, I looked at application, admission, and enrollment rates for Asian Americans between 1994 to 2019. The first graph shows freshman rates, the second graph shows transfer rates, and the third graph shows the overall rates, combining the two. In my analysis, I took the average rates from before and after 1996 to compare the two. So for freshmen, application rates dropped about 1.5%. Admission rates rose less than 1%, and enrollment rates rose a little more than 1%. Transfer rates all dropped, but within 1%. So overall, application rates dropped about 1%, while admit and enrollment rates increased, but by less than 1%. In conclusion, Prop 209 didn't really have a major impact on Asian Americans. There were slight increases and decreases, but in the grand scheme of things, that's really only a difference of a couple thousand students. Considering the relevance of the topic, I think the study could expand to include more data from 1996 and also include other minority students. Thank you for your time.
Great, thank you so much, Emily. And so this summer, Emily interned with Environment California. And so if anyone from Environment California has a question for her, just go ahead and raise your hand and Sandra will go ahead and call on you and unmute you. And if not, we will go ahead and take a question from the academic team.
Emily, I have a question for you. This is Professor Jordan Quealy here. Right. So what do you think's what do you think will happen if Prop 16 passes in November? Like, what do you think would be the impact on that passing, maybe on Asian American students or on the UC system as a whole?
Yeah, that's a really good question. So previously, the entire UC Regents Board has unanimously voted in support for ACA 5, which is also Prop 16. They said that their reason behind this was because it would propel and uphold their goal of diversity and racial equity for academics. So I think that with the inclusion of race, we would see more representation from underrepresented minorities, specifically Native populations, African Americans, also Latinos, who don't benefit as much from a race-blind approach.
Great, thank you.
All right, thank you, Emily. And so our next student is Stephen Pham.
Hi everybody, my name is Stephen Pham, and today I'll be talking about the 4-day work week, the low support surrounding it, and its associated benefits. So the 4-day work has been gaining popularity for several reasons. First, the average American has been earning less while working longer. This conflicts with how the country's experienced tremendous economic and technological growth, which would suggest the opposite. Additionally, the progress in productivity has come at the cost of worker health. Nationwide, workers feel burnt out from their workload. This is where the 4-day work week comes into play. By providing more consistent downtime, workers are able to de-stress and regenerate. Even more, the 4-day work week has demonstrated success across many businesses. If you look at Figure 1, across all measures of worker productivity and satisfaction, a majority of businesses reported favorable outcomes. With this in mind, we would think that the general reception towards the policy is largely positive. Looking at the support behind the 4-day work week, I examined 2 recent surveys. Looking through the data, there are some interesting takeaways. First, asking about the preference of schedule yielded much more support than asking about the level of backing. If you look at Figure 2 and 3, Figure 3 has a supermajority in approval, whereas Figure 2 only has a plurality of approval. As for demographics, across all races, there is a plurality of support for the 4-day work week. Although the same could be said about income, there is considerable less support for lower income groups. This may be because lower income groups may be less financially stable compared to their wealthier peers. As for generations, younger generations tend to be more supportive of the 4-day work week compared to older generations. This may be because younger generations are those still in the workforce, while older generations may be those closest to retirement. I think the findings should convey some important messages to policymakers. First, sick days and vacation days should be expanded upon. Second, schedules should be more flexible and accommodating. And third, greater union membership should be encouraged. That's it for my presentation, and thank you.
Great, thank you, Stephen. And so Stephen interned with Environmental California this summer. And so if there was a question from the office, just go ahead and raise your hand. And if not, a question from the academic team.
Hey, Stephen, this is Professor Jordan Quealy again. So I was just kind of wondering, so you're looking and you're seeing kind of, you know, employees seem to be happy with the work week. You seem to see the employers seem to be doing okay with it in terms of what you've seen. What are the barriers? What's stopping us from going to a 4-day work week instead of it? What do you think is, you know, is causing some of these issues potentially between what people want maybe and what might be actually happen?
Yeah, so that's a good question. So generally there is a consensus that there is great health benefits for the policy, but then it's just like the implementation that I was talking about earlier. So for like some jobs, it's kind of like impossible for them to switch to a 4-day work week, especially for like service related jobs where they have to constantly be there. And also I think a concern is cost, especially if you look at Figure 1, cost is like the lowest ranking category. And so for a lot of these businesses, they'll have to hire more workers. And then sometimes most managers won't think it's worth it to just cut the days and then have to hire more to replace the workers.
Thank you. That was good. Thank you.
Great. Thank you so much, Stephen. And so our next student is Joseph Chirrell.
Hello. My research analyzes the relationship between firearm mortality and gun ownership, several social factors, and gun shows. Gun violence costs California more than $18 billion annually. My hypothesis is that greater levels of gun ownership, less education, less income, higher income inequality, more non-family households, and fewer regulations at gun shows will result in greater gun mortalities. And I use state-level data for all 50 states. And to quantify my risk factors, I use the gun ownership rate, the percentage of residents over 25 who have a bachelor's degree, the per capita income, the Gini index, and the percentage of non-family households within a state. I ran correlation and regression tests for each of these risk factors separately with the firearm mortality rate. And for the gun shows, I grouped states by their level of gun show regulation and computed the average firearm mortality rate. So you can see in figure 1 that greater gun ownership was strongly associated with greater firearm mortality. And in figure 2 and figure 3, you can see that higher education and higher income was correlated to fewer firearm mortalities. And there was no significant link between firearm mortalities and household composition or income inequality. And in figure 4, you can see that states that have unregulated gun shows have significantly higher firearm mortalities. So in conclusion, higher gun ownership, lower education, lower income, and fewer gun show regulations correlated to higher firearm mortality rates. Thank you.
Great, thank you so much, Joseph. And so this summer, Joseph interned with the California Air Resources Board. And so if there's anyone from the internship host site that would like to ask a question, just go ahead and raise your hand and Sandra will call on you and unmute you.
Okay, so we have a question from Michael. If you can please introduce yourself and ask your question.
Hello, everyone. This is Michael Harris, and I'm from the California Air Resources Board. Joseph, thank you very much for your work. It's been great working with you in our branch. I have a follow-up on one of your key takeaways that says income inequality is not correlated with gun mortality. And can you please clarify on that?
Yeah. So I did make a scatter plot which compared gun-related mortality rate for each state and as well as the Gini index, and there was certainly no link between the two. The p-value was much greater than 0.05.
All right, thank you, Joseph. And so our next student is Eric Helsa.
Hi, everyone. My name's Eric Helseth, and for my research, I was looking at the impacts of the COVID-19 pandemic on transportation and specifically public transit. So even before this year, transit in California and across the nation was seeing a decrease. And just since January, California has seen as much as an 80% decrease in transit ridership. And this is a problem because public transit traditionally serves lower income communities at higher rates. So I was looking to answer the question, how or has the pandemic impact people's behaviors towards public transit, and how will these changes influence the transit sector moving forward? So I thought that people who use public transit to commute before the pandemic are now less likely to use transit due to fear of contracting the virus or now having the ability to work from home. So in order to test this theory, I used a survey on Amazon Mechanical Turk and got about 180 respondents. These respondents were asked general demographic questions about age, income, and ethnicity, as well as some specific questions about their commute distance. So as you can see from figure 2, over a third of them were aged 25 to 34, right in that working age. And over 50% of all respondents used a personal vehicle to commute before the pandemic. So through my survey, I found that only 12% used public transit, and younger people were more likely to use that public transit and less likely to use a personal vehicle to commute. About 30% of the respondents plan to change their mode of commute after the pandemic, and of that 30%, a third of those will change to a personal vehicle. And the decision to use personal vehicles opposed to public transit was heavily influenced by the distance to the nearest transit stop. So in conclusion, transit ridership will continue to suffer after the pandemic, and many transit systems may be forced to cut routes in service, which is going to increase hardship on those low-income communities. So California should really focus on maintaining the previous level of service within their transit systems and potentially even set aside funds to ensure that these transit agencies do not have to reduce that service. Thank you.
Great, thank you so much, Eric. And so this summer, Eric interned with the California Air Resources Board. And so if there was a question from the California Air Resources Board for Eric, Sandra will go ahead and call on you and unmute you.
Hello, everyone. This is Michael Harrison again from the California Air Resources Board. Eric, thank you very much for your presentation and the great work that you did in our branch. It was great working with you. I have a follow-up question on your one of your conclusions that says transit ridership will continue to suffer. Do you think this is, like, what's the timeline for this? Is it short-term? Is it just a matter of finding a vaccine? Or do you think this is gonna go on long-term?
Yeah, sure. Thanks, Michael. I think it's a little bit of both. I think once a vaccine is developed and people will start going back to work, we will see transit ridership increase, but I don't think it will ever reach the levels of what it was before, because teleworking and working from home is become increasingly common, and I think that trend of people being able to work from home, I mean, you look at Facebook or some of the other big tech companies, they've told their employees, you don't have to come back to the office ever. So I think that work from home that'll be an effect that'll stay around for a long time.
Great, thank you so much, Eric. And so our next student is Preeti Chituru.
Hi everyone, my name is Preeti Jaturu and I'm a student at UC Riverside. For my research, I assessed emergency healthcare accessibility in the Salton Sea region of Imperial County using geospatial methods. Imperial County, particularly Salton Sea region, has some of the worst environmental health outcomes in the state, with pediatric asthma-related emergency room visits and hospitalizations that double the state average. It's clear that this region is being impacted by an environmental and public health crisis. In this project, I chose to focus on a fundamental question. What is the level of emergency healthcare access in the Salton Sea region of Imperial County? I hypothesized that access would be low due to high travel times as well as competing demand for these services. I defined the Salton Sea region as all Imperial County census tracts that include the Salton Sea within its boundaries. I chose to calculate travel times rather than using Euclidean distance, or a straight line distance, as Euclidean distance fails to take into account geography and urban infrastructure such as road networks and traffic conditions, as seen in the first two figures. I also chose to use spatial accessibility models, with one of them called the Rational Agent Access Model, or RAM, as it takes into account the supply and demand for the services as well as travel times. The higher the value, the worse access is. I calculated the travel times from each census tract to all of the Imperial County hospitals and computed RAM scores for each census tract. After analyzing all of this data, I found that there are only 2 hospitals in Imperial County, and travel times to these hospitals were far higher for the Salton Sea region than other tracts. RAM scores were also higher in the Salton Sea region, meaning that emergency health care access is low. As far as policy recommendations go, preventative health measures should be implemented as early as possible to reduce the number of emergency room visits. Other policies may not be intuitive, as say building another hospital, and perhaps access can be increased via shifting and altering transit lines, which I'll be researching in the near future. Thank you.
Great, thank you so much, Preeti. And so Preeti went ahead and interned at Health Access this summer. And so if there's anyone from Health Access that had a question, go ahead and just raise your hand and Sandra will go ahead and call and unmute you.
Hi, so I see Jose has a question to ask. If you can please introduce yourself and state your question.
Hi, my name is Jose Torres, Legislative Associate with Health Access California. And I didn't necessarily have a question, but just wanted to say publicly how proud we are of Preeti and her research and all her work that she's done this past quarter with us.
Thank you so much. It's been an honor and I really appreciate that.
Great, thank you so much, Preeti. And so our next student is Chinsi Liu.
Okay. Hi, everyone. My name is Chinsi Liu. I'm not sure if my screen is.
We see it.
Okay. I'm sorry. My name is Chinsi Liu. My project is on Do We Live Long and Prosper? Depends on Place and Race. In 2011, researchers found that on average, Black Californians live 6 to 10 years less than white Californians. The significant difference led me to explore whether the life expectancy of a non-white person still differs from the life expectancy of a white person when controlling for education, income, and health. I hypothesized that racism leads to worse education, health, and income outcomes for Black and other non-white groups. And when health and education and income are the same for white and non-white groups, the existence and experience of racism will lead to lower life expectancy rates. To test my hypothesis, I created a data set that included the data for white, Black, Hispanic, or Latinx, and Asian populations for each of the 58 counties on education attainment, median household income, and health. I used this data to create the opportunity index with the help of my professor, and by using this data, the index scores for each racial group were created by weighing each category the same and then standardizing the scores for each group. I found that the relationship between the opportunity index and life expectancy for white Californians is the strongest of all groups. So when white people get more education, better health, and higher incomes, they would have longer life expectancies. But for Black Californians, the difference was the greatest when compared to all other counterparts. Black Californians also almost always score below average on the opportunity index and have the lowest life expectancies. So even when Black Californians had higher median incomes, more education, and better health, they still live significantly shorter lives than all other groups, as you can see in figure 2. Asian Californians mostly have higher life expectancies when compared to other groups, as seen in figure 3, and even when they had lower scores on the index. For Hispanic and Latinx folks, there is no correlation between living longer and having a higher score on the opportunity index, but they do still live a bit longer than Black Californians when they score the same on the index. Some policies that could help with alleviating the stress, improving the quality of life for non-white people would be increasing funding for education in poor neighborhoods that are predominantly filled with people of color, directly targeting communities that are predominantly filled with Black and Indigenous people of color and discover what types of programs would help them the most, introduce more social welfare programs that can provide public assistance to those in need, like money for groceries or rent assistance, and make these programs a lot more accessible to these populations. It would also help to introduce more racially diverse material into the curriculums for K-12 schools. And that's all for my research. Thank you so much for your time.
Great, thank you so much, Chinsi. And so Chinsi interned this summer with Health Access. And so if there is a question from Health Access, great, Jose, I see you on there. And Sandra, go ahead and unmute you. There we go.
Thank you. Again, this is Jose Torres, Legislative Associate with Health Access California. No specific question, but again, just wanted to reiterate how proud we are of Chinsi as well. She also did amazing work with us, and we are so thankful to have her with us this past few weeks.
Thank you so much for the opportunity.
Fantastic, thank you so much. All right, so our next student is Zenya Farrington.
Hello, I'm Jenya Farrington from UC Davis, part of the UC Davis majoring in political science. And my research was with the UC Davis Medical Center, and I was researching what has driven the recent spike in COVID cases. And we all know the story that early on, California's quick response to shut down abated the worst early on. However, reopening a few months ago has been incredibly problematic. So my research question was simply, what factors have driven the spike in California's pandemic? Are there socioeconomic factors, and so on? Therefore, my hypothesis was, as stated, there is no significance between factors, and that there is. My procedure was fairly laborious. I constructed a database breaking down our California by 58 counties, recording 27 variables relating to the hypothesis. I have also written a paper complementing this presentation where I delve into those 27 variables. Data was retrieved from publicly accessed databases from each county, and I ran simple regressions pairing relevant factors. And my results are that there was actually no statistic significant correlations found. Therefore, my null hypothesis remained true. In other words, I do not know what has driven this spike. Therefore, since my results are fairly unimpressive, perhaps delving into possible errors might be more intriguing to the reader. And I have listed variables, possible reasons, and also avenues for future research. Thank you very much.
Great, thank you so much, Xenia. And so this summer, Xenia interned with UC Davis Health and a faculty member there. And so if there is anyone that has a question from his office, please go ahead and raise your hand, and Sandra will go ahead and call on you. And if not, we'll go ahead and take a question from the academic team.
Hey, Xenia, this is Professor Jordan Quila here. I guess I'm just, kind of curious. You've looked at kind of all these relationships and stuff, and obviously you've been tracking, obviously over time, what COVID's kind of been doing. I guess, where do you see this? Where do you see it going in the United States and California? Is it going to be here for? I mean, what do you think is going to be happening going forward? I guess overall with COVID.
Yes, well, that was one possible error, a major one I discovered, was that trying to construct a database with a moving target was nigh impossible, for I am not a one-man army. And thus, if there is interest in further research, perhaps a team would be required. Now, what I project, I cannot even project where I think this is going, because again, there are too many moving variables, and what do I know about any relation? I apologize, I cannot flesh out an answer more, but I simply do not know.
Fair enough, thank you.
You're quite welcome. Thank you, Professor.
All right, thank you, Xenia. And so that one was actually our last presentation, and so we do have time left in terms of opening it to questions from the audience. And so if you would like to go ahead and ask a question of any of our students that presented today, go ahead and raise your hand, and Sandra will go ahead and call on you, unmute you, and you can go ahead and just state your name, affiliation, and then which student that you had a question for.